There's a very popular YouTube video with over 3 million views as of right now. It's a famous guy named John Oliver. I've never heard of him, but he's a late night comedian. And this time, what's very interesting is he talks about Medicare Advantage. And he goes into a whole bunch of things that we've covered over the last few years, but he put them all in one show. And yes, he had some comedy with it. My goal here, I want to show you some of these clips, but I'll play brief clips and I'll pause quite often and analyze claims about the Medicare Advantage. And my goal is education and criticism, not to substitute for what he's already doing. I encourage you, if you want to, see the whole piece. However, I will warn you, my mom won't watch it because of the profanity and the sexual innuendo and all the other stuff that's in there. I won't show you any of that, but the claims that he makes about Medicare Advantage are founded, and I want you to see what he had to say. It's quite interesting.
But while they're often framed as being about Medicare, they're actually promoting something called Medicare Advantage, and that is different. Because while Medicare Advantage has the word Medicare in it, it is not what you may think. It's not health insurance provided directly to you by the government. Instead, it's a different system where the government pays private insurers, typically owned by companies like these, to administer your benefits for you. Honestly, it probably shouldn't have the word Medicare anywhere near it because it's misleading. It's kind of like the mountain chicken. Picture what a mountain chicken looks like in your head right now. Do you have it? You're wrong, because
I'll just tell you that over the years, I've had thousands of people complain that the word Medicare Advantage has the word Medicare in it. And actually, a Democratic representative in the House in California tried to get a bill passed that would take out the word Medicare Advantage and just call it private Medicare.
Which is just wrong. That is a misuse of words. Anyway, the point is, thanks to blanket advertising and the fact some employee retirement packages offer these plans exclusively, more than half of eligible Medicare beneficiaries are now enrolled in a Medicare Advantage plan, a percentage expected to grow to nearly 2/3 by 2034, which is concerning because these plans can have real issues. One expert has said the best candidate for Medicare Advantage is someone who's healthy. We see trouble when someone gets sick.
And absolutely, I would say it's a bait and switch because you get to that point when you do actually need those bigger things and you're denied.
So it looks like a good plan as long as all you need is like dental or vision. Everybody needs dental or vision. Nobody plans on melanoma, correct?
Correct, yes.
Or on other kinds of acute rehabilitative or long-term rehabilitative care.
Yes, that's correct.
But that is a problem, because statistically, most people will get sick. It's just a fact of life, like all hamsters die, most cats hate you, and that's by no means the only flaw here, because as you will see, while these plans can be great for companies' bottom lines, they can be woefully insufficient for those who signed up for them and the providers who have to deal with them. Medicare Advantage basically has all the problems of private insurance, but applies to a more vulnerable population. So given that, tonight, let's talk about Medicare Advantage.
And Medicare Advantage will save the government money, which it really needs to do because they always talk about the Medicare Trust Fund is going to go out of money, right? Well, let's look at that.
These plans have never saved the government money. In fact, a report last year estimated Medicare Advantage had cost the government over the previous 18 years an extra $591 billion. And this is partly down to the fact the major companies involved need to make profits for their investors, and they have found ways to do that. One concerns how they get paid, because in traditional Medicare, a provider treats you and the government pays a fee for it. But in Medicare Advantage, plans get a fixed payment from the government for each member they take on, regardless of whether you get treatment or not. And crucially, that payment's based in large part on what illnesses you're listed as having, because...
Let's talk about that real quick. On original Medicare, like he said, doctor bills something, it goes and it gets automatically paid as a claim. The doctor does not have to get anyone's permission for that. That's original Medicare, which a lot of agents don't even tell seniors you're able to get original Medicare with a Medigap plan, because it pays a lot less commission if the agent puts you on a Medicare plan and a Medigap plan to pay the other part. But then there's no networks, there's no prior authorization, there's no restrictions, and you don't have someone denying the claim. Medicare Advantage, however, like he said, is paid through capitation. It's per member, per month. So they get paid for you regardless of how much care they deliver, and they pay on the back end for you. So the least amount of care that you get, the more money that they make in profit. And those that are shareholder-owned, publicly traded companies that do Medicare Advantage, their one goal, their primary goal, is to return a profit to the shareholders.
Insurers are entitled to extra money when their patients are diagnosed with conditions that are costly to treat. Here's a report from several years ago explaining how it basically works.
The insurance company uses what are known as diagnosis codes to report that person's level of sickness to the government.
Well, they pay one rate for plain old diabetes, and then they pay another rate for diabetes with complications. If you write down in the file that the patient has diabetes and has complications with eyesight or other things, they'll get paid a higher rate.
Right, and in theory, that makes sense. You want insurers to take care of sicker patients. Unfortunately, a lot of things that sound good turn out to be terrible in practice, like overalls on adults. Or the same is true here, because the government paying more for sicker patients has given insurers an incentive to identify as many health conditions as possible for each enrollee and potentially to then game the system. They can find lots of ways to add big money diagnoses to patients' charts.
And they're doing exactly that. Let's look a little bit deeper into what the insurance companies have been caught doing red-handed by the government and what's going on there.
Billion over 3 years for diagnoses added just by insurers. Not only that, many diagnoses were added for which patients then received no treatment, and often neither the patients nor their doctors had any idea, which isn't great, is it? The whole point of a doctor is for them to diagnose you. And while insurers will claim they're just being thorough, they've been repeatedly accused of essentially pulling a Munchausen by paperwork. In 2022, the Times found 8 of the 10 biggest Medicare Advantage insurers had submitted inflated bills according to federal audits, and that 4 of the 5 largest players had faced federal lawsuits alleging that efforts to overdiagnose their customers had crossed the line into fraud.
Let me tell you how this affects you. And we've seen this over and over again. Let's say you're a senior, you're 65, they come out, they meet with you, which we'll talk about in a minute, what is hideously hidden about that. And then they put all these diagnoses in your medical report. Then you come to me and you say, you know what? I heard you do life insurance too. I'd like an estate plan with millions of dollars so I don't have to pay any estate taxes. Or I want to leave this chunk of money that's earning 1 or 2% in a CD. I want to leave that money for my kids, and I want you to multiply that using insurance 50 or 100 times, which is what we do. Then we go to apply for life insurance for you, and we find all these diagnoses in your chart, and we can't get the life insurance. And you say, wait a minute, I've never had that condition. Well, my very next question is, are you on a Medicare Advantage plan by chance, or ever been on one? Why, yes, I am. Well, the insurance company inflated your bad health so they can make more on you every month to the tune of almost 10 times more than they would make if you were just a regular person. And then your health record is damaged forever until you fight to get it off with you're going to the doctors, you're getting your medical records, and you fighting with companies like Milliman and getting those things off. It's a gigantic pain, and that is how it affects you.
And some have been accused of getting very sneaky to add patient codes.
Here he's going to talk about the health risk assessment. And what you might not know and what agents don't want you to know is that we as agents get paid when we sell you on a Medicare Advantage plan. If you're brand new to Medicare, it could be $800 that we get paid to put you on a no-cost Medicare Advantage plan. But here's the other part. With many of these companies, if we do a health risk assessment, which is an interview with you to ask you certain health questions so they can up-diagnose you or upcode you, we get a bonus. Sometimes it was up to $150. We'd get a bonus for asking 5 minutes worth of health questions. So they can say, well, the agent found out in an interview on the phone that they qualified for this, this, and this diagnosis code. Did your agent tell you about that before? No.
Home visits with ads featuring happy seniors excitedly greeting healthcare workers at their door. Here's how United Healthcare advertises theirs.
Remember the good old days when doctors made house calls? United Healthcare offers their Medicare Advantage members an annual visit from a licensed clinician in their own home at no extra cost.
At no extra cost to you until you look at your medical record later.
Home visits may include a review of your medical history, a check of your vital signs, and a chance to talk about your health concerns. With house calls, being healthy starts at home.
Yeah, and you can see how attractive that is, not least because the senior gets a visitor, and you know how happy that makes them. The elderly love exactly 3 things: having guests, talking to guests, and then freaking out when that guest sits in their chair. But an investigation found that in programs like that one, companies push nurses to run screening tests and add unusual diagnoses, turning the roughly hour-long stops in patients' homes into an extra $1,800 per visit on average. And while United will insist most of the conditions it's coded for in its house calls program haven't raised payments, some very much have. For instance, documents show its software would suggest the diagnosis of secondary hyperaldosteronism, a condition in which levels of the hormone aldosterone rise without requiring it be confirmed by a lab test. United Healthcare apparently diagnosed that nearly 250,000 times after home visits, leading to $450 million in government payments over just 3 years, even though a former house calls nurse said in 1,000,000 years I wouldn't have come up with a diagnosis of secondary hyperaldosteronism. And
Now, what does that sound like to you? Now, you've just heard time and time again what the Medicare Advantage companies are doing. And this is a comedian that's using things like Stat, Wall Street Journal, and real documentarian reporters who are actually quiet. Nobody ever reads these things. And that's what we cover on this channel all the time. The Senate hearings, the House hearings, the Ways and Means Committee, like nobody's covering this. And now it's in the spotlight. And I just can't believe it.
of course not. I didn't even know what hyperaldosteronism was before working on this piece. And to be honest, I still don't really know much about it. Aside from the fact that you can rearrange the letters to spell modernist horseplay, which...
He does have some funny things, and you might want to see the whole thing. But at the root of it, it's about Medicare Advantage and the parts that you don't know. And here's some stories coming up that are really heart-wrenching.
Isn't nothing, but it does feel close to it. Now, I have to tell you, United Healthcare claims that report misrepresents house calls, which is just about supplementing doctors' visits and identifying gaps in patient care. I presume that they're currently making that same argument to the DOJ's Criminal Healthcare Fraud Unit, which is investigating its Medicare billing practices, and I wish them the very best of luck with that. But they are not the only company who face these sorts of accusations. An insurer called Independent Health faced similar claims, including that a woman in one of their Advantage plans was apparently coded for prostate cancer because, according to an internal email, when a married couple has any disease, both were assigned to that disease, which is both ridiculous and also kind of romantic. To tell you, Independent Health did not admit liability, but they did pay $98 million to settle that lawsuit. You know, the exact kind of thing you do when you're not liable for something. So,
in the next part, he's going to talk about who Medicare Advantage is really for. And is that accurate?
at this point, I think it's pretty clear these plans aren't a particularly good use of taxpayer money. But are they good for patients? Well, on the surface, cheaper premiums sounds appealing. And if you're relatively healthy, these plans can seem like the more attractive option. Just listen to this woman explaining why she and her husband picked one.
We are very active. I play pickleball twice a week. We have a big garden. We have animals that we take care of. And so we're always doing something. And we wanted to retire while we were still able to do things together. And that we like the Advantage plan because it seemed to fit our needs for that.
And what we have seen in dealing with more than now 22,000 people across the United States with their Medicare plan and making recommendations is if we listen long enough, we will hear about the same thing every time. When somebody's turning 65, they say, but why shouldn't I just go get that $0 plan? Because I'm healthy. I've been healthy my whole life. And our question has to be, let's look ahead 5 years. A Canadian study that I talked about years ago showed that disability in seniors, when they can't do more than 2 or more activities of daily living, happens all the time between 70 and 72. But if you can pick a plan at 65 that you may get stuck in, we'll talk about that in just a minute, for the rest of your life, is that the plan you want to be stuck in, one that's only good for you when you're healthy? Is that what you would want to have?
And I get that that makes sense for her right now, because from the minute I saw that woman, I knew she played pickleball. She didn't need to tell me that. Everything about her screams, I'll dink your kitchen, then cross-court lob until we bagel, because je suis le pickle. And Medicare Advantage plans go out of their way to recruit people like her. Many even offer perks like gym memberships, which can be disproportionately attractive to relatively healthy beneficiaries. But once you get sick, you can find out your plan has a lot of limitations. For example, under regular Medicare, you can go to any doctor or hospital that takes it, which is most of them. But with Medicare Advantage, as with most private insurance, you can typically only use doctors in the plan's network and service area. And as those can change at any time, a doctor who is in network when you sign up can quickly fall out of it. And that can...
And remember what we found out about all the doctors, the physicians groups, and then the 33 major hospital systems for 2026 have announced that they're not taking Medicare Advantage anymore. We'll talk about the reason for that in just a minute, but this is happening a lot. people sign up for the Medicare Advantage plan, they use the wrong information that's now found at medicare.gov, saying that your doctor is in the network or your hospital system's in the network, only to find out later, oh my God, it's not. But in just every other year, we've seen the same thing. People rely on the provider network when they make a decision, thinking that's the way it's going to be for their entire next year, because Medicare Advantage benefits only stay solid for 1 year. Those benefits won't change, but your network very well might
be a big problem. Consider this woman who had cancer and who qualified for Medicare due to disability, but signed up for a Medicare Advantage plan thinking that it would save her money.
I went for my routine checkup. I'd been a Dana-Farber patient since 2013, and I got a bill. They're saying the providers in
We keep saying that company name over and over again. I don't know why. Did you catch it?
network in the building, but the building of Dana-Farber is out of network, and I'm not allowed to go there anymore, even though I'd been going there and had the same insurance. So after all of these years, I have now moved my care to a different hospital because I can't go there anymore.
That is absurd. Her doctor was in network, but the building wasn't. It's one of those things that makes your brain hurt if you think about it for too long, like how gravity works or what. But it can be genuinely hard to find someone in network on an Advantage plan. And even if its list of providers looks good on paper, it can quickly collapse under the slightest inspection, as this man discovered.
I'm diabetic, so I looked under endocrinology. There were 4 listed, and the first 2 were at Schnuck's grocery stores, and they weren't endocrinologists, they were just pharmacies. So apparently that means that they offer 2 endocrinologists in this 25-mile radius, and that has me hugely concerned.
Is that enough for the senior population here?
No.
Yeah, of course it isn't. And finding out half your list is just grocery store pharmacies would be frustrating, because everybody knows you don't go there for an endocrinology appointment. You go there to check your blood pressure in the machine that makes your arm feel like it's being squeezed by Paul Mescal's thighs. That is a thing that we all do. And that is not a one-off either. One review found the majority of Medicare Advantage organisations had between 30 to 60% inaccurate locations in their directories. But
do you remember this from the Senate hearings? Maybe you don't. Let me show it to you again.
Investigators looked at a cross-section of mental health plans across the country. They contacted the providers. They asked if they could get an appointment for a family member. They were able to get an appointment 18% of the time. So more than 80% of the time, their plan actually failed them. Even if a senior could make an appointment with provider and get this, they may be exposed to extra costs if they have to go to a provider out of network. In other words, they paid for something, there wasn't any service, they need some health services, they go out of network, and the person they gave the money to originally sticks them with the second bill.
That only happens in Medicare Advantage, by the way. Let's move on.
You can find a provider. You may then have to deal with something called prior authorizations. Now, you're probably familiar with them from employer-sponsored plans. Well, traditional Medicare almost always pays for the care your doctor says you qualify for. Virtually all enrollees in Medicare Advantage are required to obtain prior authorization for some services. While these plans are supposed to cover all medically necessary services that original Medicare does, actually getting approval can be a grueling process, as this doctor explains.
We have to call for a prior authorization, and we can't do it electronically. We actually have to call on the phone, the old-fashioned telephone. We have to call an 800 number, some number, and then we have to give them all the data. We have to give them the insurance information. We have to give them the patient's date of birth, things like that. And then what they do is they give us then an authorization to fax them the information. So I've called them to get permission to fax them a request. And then once they've got it, I've got to call them while they discuss the fax. That's another barrier and obstacle to care that's incredibly time-consuming, has no value added, and it seems antithetical to trying to get prior authorization. What I really am getting is a prior authorization to get a prior authorization.
Yeah, and everything about that sounds like a nightmare, including the presence of the words fax machine. I thought we'd stopped making them around the same time that we stopped making good romantic comedies. In fact, as you might guess, Medicare Advantage providers partly or fully deny millions of prior authorizations each year, and that can be maddening for those who need care.
Remember this little clip? Let me share this with you.
Authorization is a nightmare.
It cripples my patients, it cripples my medical practice.
It takes a lot of the joy out of medicine.
So the amount of time that it takes myself and my office staff to go through that process now for almost every prescription we write has gotten to be an enormous problem both for us and for our patients. They're spending something like 15 hours a week per physician just filling out these forms and waiting on hold for the insurance companies.
Dr. Oz had a big press conference that said he got the insurance companies to agree to stop doing so much prior authorization. Guess who's in the room? Medicare Advantage companies only. It's voluntary.
Access for patients. This is a critical issue because imagine you're in a doctor's office and you've got a bad diagnosis and there's a procedure or test or treatment that you think is right for you, and you find out that you can't start that treatment for sometimes weeks, even longer. It's more frustrating than anything else in the process because at least that's something you do control. You don't control much else when you're in a physician's office with that kind of a crisis, and yet it's withheld. And these approvals with this new pledge will be streamlined. It will happen very quickly. Necessary care will be delivered when it's needed in the right way. So you get both quality and you get timing, which goes along with that quality.
Did you pick up on the fact that this is a pledge? This is a pledge from the insurance companies. They know this is a real problem, and they know that Congress was coming after them based on the new administration saying they're going to crack down. Remember, Dr. Oz said there's a new sheriff in town. Dr. Oz, and you can call it naivete, you can call it ignorant, you can call it whatever you want. I'll just tell you that when you get an insurance company who, again, is trying to make a profit for the stockholders, you get them to agree to do something on their own without any threats of oversight or regulatory action against them or fines or fees or criminal charges, we're going to see how that all ends up. Here's the other part. Let's say that you did get prior authorization, you're moving toward the treatment, and then you find out all of a sudden that treatment's been revoked. Now you have to appeal. Again, this happens on the Medicare Advantage side. Let's see how that works out.
Gary Bent, he had significant complications from brain surgery, including being unable to stand or walk on his own. His doctors said he needed a lengthy stay at a highly skilled rehab center. Now, under traditional Medicare, that would have been covered. But he had a Medicare Advantage plan from United Healthcare, which only approved him for a few weeks at a short-term rehab facility. And Gary's wife and daughter remember the advice that they got from his care team about trying to appeal United's decisions.
They told me I would probably win 1 or 2, maybe even 3, but then the speed with which these denials came would increase. They would be fewer and fewer days apart, and eventually I was going to lose.
We felt like this process was designed to wear us out, and I would say it did wear us out.
Yeah. And that's exactly what happened. They won 2 appeals, then lost a third after an external reviewer sided with the company. While United Healthcare insists it was just following Medicare guidelines, Gary was sent home before his family felt he was ready, with, by the way, a fever and neck pain. And within 11 hours of being discharged, he was rushed to the ER where he was diagnosed with meningitis. And that was just one step in a quick decline towards him dying the following winter, a decline that his wife says was made worse by the added trauma of having to fight for the care he needed and was entitled to. And there are some things so awful, it's almost impressive to be able to make them.
Remember this from the Senate hearings that we covered? It's on the top of our YouTube channel. This is an attorney who works with seniors exclusively on trying to get these appeals overturned. Listen to this in case you missed it.
Senior has original or traditional Medicare, they can expect to receive up to 100 days of coverage for their stay with no hassle.
Just for all you insurance agents out there that make your fortune selling only Medicare Advantage, that are always putting stuff on LinkedIn and posting things that I'm not right, that when you say things, just like I saw yesterday on LinkedIn, where an agent that I know lied to your face and said that original Medicare and Medicare Advantage have to cover the exact same things. And if you're fresh out of insurance school and that's what your belief is, then good for you. If you've talked to more than thousands of people that are on Medicare Advantage and they've experienced this very thing right here that she's talking about on live television in the Senate hearing, the lawyer who's helped thousands of people with this, and you know better as an insurance agent, and you're still putting out crap that Medicare Advantage treats you exactly the same way as original Medicare. For those of you in Rio Linda, let me play that again for you, because this is the truth right here.
If a senior has original or traditional Medicare, they can expect to receive up to 100 days of coverage for their stay with no hassle. If a senior has a Medicare Advantage plan, however, they can expect to receive a denial well before their doctors even say they're ready to go home. This is despite the requirement that's been discussed that Advantage plans must offer the same benefits and apply the same coverage criteria as original Medicare. When a patient first receives a denial, they're thrown into a maze of red tape that is dizzying even to our experienced legal team. The initial denial is made not by the Advantage plan, but a third-party contractor using an algorithm. A computer determines what a patient's predicted length of stay should be based on millions of past beneficiary data points, not the patient's plan of care or the advice of their doctors. Then, at each additional level of appeal, if the patient actually chooses to fight it, the denials are upheld by quality improvement organizations with little to no explanation. If a patient is successful with an appeal while still in the facility, they can expect a new round of denials to start in a matter of days. Patients caught in this maze are forced to make a devastating decision: stay in the rehab facility and pay thousands of dollars out of pocket, or go home against medical advice.
Just absolutely freaking sick.
Laying, underpaying or denying care doesn't just hurt patients, it hurts hospitals too, particularly those in rural areas, because they don't have the time or resources to sink into constantly appealing decisions, which has had real consequences.
This was once the geriatric psychiatry unit at Alliance Healthcare in Holly Springs, Mississippi. Now the hallways hollow and beds sitting empty. This operating room only a few years ago was doing 5 or 6 procedures a day. Now, 0. Dr. Kenneth Williams is the CEO. He says the hospital can no longer afford the unit, or any inpatient care for that matter. All of this used to service people that really needed help, and now it's just totally empty.
It's empty, it's gone, and it died the last few years with Medicare Advantage.
That is terrible. Thanks to Medicare Advantage, that whole wing is now abandoned, and even hospitals which haven't had to close wings have stopped taking these plans, with a 2023 survey finding nearly 20% of health systems had stopped accepting at least one Medicare Advantage plan that year alone.
Remember, now we've heard from Mayo Clinic, Johns Hopkins, Sloan Kettering, a whole bunch of big ones, national healthcare systems, that they're not taking Medicare Advantage, or they're not taking the biggest of the Medicare Advantage plans. And if you watch my video closely where I talked about how this is happening, they cite two things.
The hospital system said after 8 months of negotiations, they couldn't find common ground, accusing the insurer of putting profits over patients with what they call excessive prior authorization requirements, frequent treatment denials, administrative burdens, and delayed payments. United Healthcare disputes that. The company says it was preparing to send a counter-proposal September 15th until Hopkins told them not to bother.
Prior authorizations and denial of care and not paying their bills. So we've covered a whole lot here. We've covered that it's not original Medicare. We've covered that it treats things completely different. You have to have a network. The network can change anytime. They can deny prior authorization, which is unique to Medicare Advantage. And then the hospitals themselves are saying that we're not getting paid. Our doctors want this treatment, and the treatment's not being allowed to happen. So what happens? As happened in our office today, we had a person call us and they say, I've been on this very inexpensive, no premium. He called it free. We didn't call it free because we're not allowed to, because it's really not Medicare Advantage plan. And now he has cancer. So he wants to go back to original Medicare and get a Medicare supplement plan. Can you do that? In most states, no. And here is the problem. And we're going to talk about this. When you're wanting to go back to original Medicare and you were on the wrong plan to begin with, it's kind of like people that want life insurance at the very point in life where they find out that they have a terminal disease. That would be akin to trying to buy homeowners insurance when your house is already on fire, or buy car insurance right after the crash just happened. That's not how insurance works. Insurance is supposed to spread the risk over a large group of people that are paying premiums on a regular basis, so that when the time comes and you need it, it's going to be there. They don't insure guaranteed claims.
Well, you know what? That's okay. If I get sick and I need a specialist, I'll just switch back to regular Medicare. You may not be able to, because remember, it has that 20% gap that you need to cover. Now, when you first enroll, It's easy to buy a Medigap plan to do that because they can't hold pre-existing conditions against you. But in most states, once you've enrolled in a Medicare Advantage plan, Medigap insurers are allowed to reject you based on them. So as a practical matter, once a patient enters the Medicare Advantage system, they typically can't afford to leave. Think of it like Scientology or a beanbag chair. Easy to get in, very difficult to get out.
This is a common misconception, though, and let me correct something because I see it thousands of times in the comments on YouTube. And if you had experience with this, I encourage you to comment on this video and tell me what your experience is with it. But here's the deal. If you want to leave Medicare Advantage, you can do that 2 times a year. One during the annual election period, which is October 15th through December 7th. You can choose for January, I want to go back to original Medicare. I want to have a Medicare supplement or no supplement at all, and you pay 20% of all the outpatient bills and a big deductible to go in the hospital and other things that the supplement would have taken care of for you. But if you want to go back to original Medicare, I encourage you, don't do so. Don't give up your Medicare Advantage plan until you get an authorization approval through underwriting for the plan that you want to go on. So you're saying, well, what's involved in underwriting? How does that work? What's going to be the questions that are asked? I actually have something on that right here. It's right here. If you look at that website, it's seniorssavingsnetwork.org/underwritten. If you want to be underwritten or look at the process, I go through the actual health questions from a major insurance company, and they're pretty similar with most of them. Some, though, restrict you on height and weight. Some don't. But with regard to the other things like diabetes, that's pretty common. If you've had heart attack, stroke, or cancer in the last 5 years, that's a no-go. If you have some chronic condition that is like rheumatoid arthritis, something you're going to be with for the rest of your life, and it's a very expensive claim, that's going to be generally a turn down. But a lot of people are surprised to find out that they actually would qualify if they went through underwriting. And this resource right here, I encourage you to spend some time in that video where I go through how the underwriting process works. And this is the biggest part. Go through an independent broker that does not just work for one insurance company that knows the whole field, because oftentimes we can take somebody's condition, and yes, it's going to be denied if you just went to the carrier directly yourself, because a lot of times people will go to Medicare.gov and they'll say, well, in this plan G, this shows to be the cheapest premium. Let me go with them. Oh, I got declined. I guess I have to stay on Medicare Advantage. No, they're not all the same. And an experienced broker can tell you, based on your condition, don't even apply at this company. Here's the company that's most likely going to accept you. By having the entire field of plans available for us to look at and knowing the experience of what they're looking for, what John Oliver just said, is often not true. You could go back to original Medicare. You could get a Medicare supplement plan if you had the right person guiding you and getting you to the right plan. So you're not even wasting your time. Another question people ask is, well, if I apply for a plan and I'm declined, does that mean I still have to pay for the first month's premium or deposit, or it goes against my credit record or something like that? Absolutely not. They don't take money from you until you're approved at the plan, and then that prepays for your first month. But you have to do it during annual enrollment period, which is October 15th through December 7th, choosing a January date, but you also have another period of time that you can do a Medicare supplement underwritten and get off of Medicare Advantage. That period is January 1st through March 31st. January 1st through March 31st, you can decide again, and this happens a lot with people who get on a Medicare Advantage plan, only to discover when they try to make an appointment with their doctor or their specialist or book something to have done, oh my gosh, they're not in the network, or this is my benefits, I got it in the mail, this is not at all what I signed up for. Especially this happens with the do-it-yourselfers, with those people who are like, oh, this looks like a tremendous plan. My doctor's in there, but they forget to see what the copays are every day if they have to have real treatment. So it's that point, January through March 31st, that you could decide again on a different Medicare Advantage plan. Hopefully you have somebody help you with this, or go back to original Medicare. And that would take effect on the 1st of the next month. So we could help you with that too, if you need it. But wrapping up the conclusion here, this is some pretty good stuff. His conclusion, how he wraps up everything about this look into Medicare Advantage. Let's take a look.
This together, you get a system where the incentives are clearly set up for insurance companies to make you look as sick as possible on paper while doing as little as possible to help you when you actually need it. Now, the industry is going to dispute that. They've even funded their own studies suggesting their plans actually save the government money and deliver consistently better health outcomes than traditional.
This is anything like the press releases or the commercials you see from the Better Medicare Alliance. The Better Medicare Alliance is the PR firm and the Washington lobbying firm that Dr. Oz just spoke at 2 weeks ago, it's only Medicare Advantage companies that put their resources together to try to put the best light and the best spin on anything having to do with Medicare Advantage out there. But what about those studies?
Medicare, though, when Stat News asked more than a dozen leading health policy experts to review a bunch of those studies, they found they had fundamental flaws and obvious biases, and on the whole were so skewed, they basically constituted an alternate reality. And look, if these companies are living in such a dangerous fantasy world, they clearly need professional help. Luckily, I happen to know a board-certified therapist who can see them. We should, at the very least, be calling Medicare Advantage by a different name, and ideally one without the term Medicare anywhere near it, because as you've seen, they're just not the same. Honestly, though, it is tough to talk about potential reforms right now, given who is in charge of Medicare currently, because in case you've forgotten, it is this guy.
22 across, 8 letters, starts with M. A government entity dedicated to the health.
In case you missed it, when Dr. Oz was nominated for this position, I ran a big, long video showing all of his Medicare Advantage stuff in the past, where he would have people on there, and then he actually got his insurance license to become a licensed broker to get commissions on all the Medicare Advantage plans that were sold from his infomercial using his name and likeness.
So how many of these plans are there out there? They sound good.
It really is a lot to get out of one plan, and honestly, Dr. Oz, there's no other option on the market like this for our Medicare beneficiaries. Over 2,000 Medicare Advantage plans are available nationwide, and most of our Medicare beneficiaries do have access to the $0 premium plans, depending on the area that they live in.
I would think if I could get potentially $0 expense for some of the things we just talked about, I'd be signing up. So why are not more folks signed up?
And then the fact that he's nominated to be in charge of all of the Center for Medicare and Medicaid Services is pretty horrendous.
The seniors. Mehmet Oz.
It's Medicare.
Mehmet Oz fits.
It's Medicare.
So guess what? I work for you now. Yep, they put me in charge of Medicare. Now, how cool is that?
Not cool! Not cool at all! And it is just wild to see someone who's been on TV for 2 decades give the single worst line reading I have ever seen. And remember, we just watched these two go to town. But one of the many reasons it's not cool is that Dr. Oz not only promoted Medicare Advantage in sponsor segments on his TV show, he once co-wrote an op-ed titled Medicare Advantage for All Can Save Our Healthcare System, basically suggesting that we roll it out for everyone. And while he's recently acknowledged some of the problems that I've mentioned, he's also said the administration wants to give insurers an opportunity to voluntarily fix them, which I would say is the most ridiculous thing that he has ever said, except...
Okay, you're going to ask me this. Okay, Chris, you're talking about Medicare Advantage, how awful it is. But one, I've had a great experience with Medicare Advantage. Yes, I've seen your comments, thousands of them. You've had a great experience. And then when we ask in the follow-up, most of you say I'm 66 years old. Or I'm 67 years old. Fantastic. If you can make it through your entire Medicare journey, the whole thing that you go through from the beginning until the end, and you have a great experience on Medicare Advantage and you never have to use it, that's great. It's great until you need to use it. It's great for the small things, but not necessarily the big things. And that's when you find out what you actually bought. So what do? If you can afford it, consider a Medigap plan, Medicare supplement plan. There's even a plan called High Deductible Plan G that functions a little bit like a Medicare Advantage in one respect, and that is that it's got a very low monthly premium, typically between $40 and $80 a month. And it gives a big deductible there. If you cross over the deductible, and that amount changes every single year, but if you hit that deductible of paying things out of your pocket, then the Medicare supplement plan pays everything. So it'll feel like when you're paying your costs with Medicare, as you're going through, you're paying all the bills, you're paying the 20%, you're paying the Medicare Part B deductible, you'd pay the Part A deductible if you go in the hospital, which is significant. However, you've got a safety net there. The safety net means you won't drain all of your money out of your bank account. And if you compare it, the High Deductible Plan G deductible that you have to hit before it kicks in, it's a max out of pocket, really is what it should be called. When that kicks in, you don't pay anything else for the rest of that year. So it is a safety net, and you have no networks, no restrictions, no prior authorizations to speak of, and you can go anywhere you want to in the country that accepts Medicare, which is just about everybody. So it's got a safety net, which is less than what the max out of pocket would be on most all Medicare Advantage plans. Let me say that again slowly. On a Medicare Advantage plan, people say they nickel and dime you to death. They have copays and huge deductibles and copays and all that. On a high deductible plan G, you're merely paying the part that Medicare doesn't pay after Medicare negotiates that price down to the Medicare allowable amount. That's a significant thing. It's a huge savings. Doctor says they want to charge you $400 for a visit. Medicare says, that's nice. That visit's only worth $90 according to our fee schedule. The doctor has to accept $90. They don't bill you the difference of all the rest. You only have to pay 20% of the $90. So you're paying small copays as you go along with the high deductible plan G, but you maintain the freedom and the flexibility to go anywhere you want with no one telling you what you can't do. That's pretty important. So consider high deductible plan G before you give up a Medicare supplement plan altogether. It might be something that's worthwhile to you. But if you have to be on a Medicare Advantage plan, and yes, we've got thousands of people who are. Why? Why do you sell a Medicare Advantage plan? Because not everybody can afford a Medicare supplement. We get that. Some people have what they used to say is a champagne taste on a beer budget. Well, we have plenty of different kinds of beer, but you don't want to have the beer without somebody guiding you like a sommelier. That's a wine reference with beer, but hey, it works. You need to have somebody guide you to the right plan so that you don't get stuck with a plan that's too small, too many insured lives elsewhere in the bigger plans you didn't go with. You went to a tiny plan with not enough insured lives so that when the rate increases happen, it hits you like a Mack truck. You don't want to be stuck on a plan like that because similar to a Medicare Advantage plan, if you get on a wrong Medicare supplement plan, you can't move to another one because to go from one plan to another in most states still, you have to go through underwriting. Now, more and more states are passing the birthday rule. I get that. But it's important to have somebody guide you through the process so you're not on your own trying to figure all that stuff out. It doesn't cost you a dime more. What they charge you directly, if you did all the work and all the research and all the pain and anguish and maybe picked the wrong plan, what you'd pay there is the same thing you'd pay if a broker did all that work for you. It can simply guide you and say, hey, you got a good plan there. Don't touch it. Or here's something that might work better for you based on what you told me first by listening to you. So John Oliver's piece has been really insightful to me. It's shown a lot of the different studies and video clips that we've seen over the years. I added a couple more here for commentary, but I want to know what you have to think about this. Watch the full thing. If profanity and sexual innuendo and all that kind of stuff does not offend you, it's on YouTube, but it does shed more light on this topic of Medicare Advantage because the only thing that's being said out there in the ether in the main media world is what you're getting paid to put your eyeballs in front of. They're paying to put this commercial in front of you that Medicare Advantage is no cost. And it's just like original Medicare. In reality, it's not. So if you're going Medicare Advantage, go in eyes wide open, knowing that you're going to need somebody to be your advocate. Thanks for watching. God bless you. And stay tuned for more updates. Please share this video with somebody who's considering their Medicare Advantage or their Medicare supplement choices going forward. Talk to you soon.